To ask the Minister for Health the reasons 3,135 persons have been waiting for an outpatient consultation at University Hospital Galway since before January 2017, and if you will make a statement on the matter.
Thank you.
I want to thank Deputy Rabbitte for raising this matter, and it's quite timely because improving access to hospital appointments and procedures is a key commitment of government, and I know a key commitment of your own as well. And as a result of some of the work we've done together in recent budgets, I hope to be in a position to publish a joint Department of Health, Health Service Executive and National Treatment Purchase Fund scheduled care access plan for 2019 very shortly. This will set out commitments aimed at improving access for patients waiting for hospital operations or procedures, and we've made a lot of progress on that side of things over the last number of months and years, as well as patients waiting this year for a first outpatient appointment, in keeping in the HSE's National Service Plan and the increased funding total of €75 million that we have for the NTPF for this year. Access to outpatient services does remain a significant challenge. As I've said, we've seen very significant reductions in the number of people waiting for a hospital operation or a hospital procedure, but outpatients now remains the big challenge, and that's where our focus needs to really be deployed. In 2019, over 3.3 million people will attend HSE outpatient clinics, and the NTPF will now this year run an outpatient appointments plan as well, which will see an additional 40,000 first outpatient appointments take place, specifically in relation to Galway University Hospital, which the Deputy asks about. The outpatient waiting list figure for the end of December shows that there were more than 39,000 patients waiting for the first appointment. 71% of these were waiting 12 months or less, but these numbers are still far too high. There has been some stabilisation in this waiting list compared to December of the previous year. Last year I met with the CEOs of all hospital groups, including the Sale to Hospital Group, which has responsibility for Galway, and asked that they come up with outpatient initiatives, including the use of virtual clinics, to address outpatient waiting lists, so that we could try and fund new initiatives this year. We have seen some progress made by the Sale to Hospital Group as a result of new initiatives, including an 11% reduction in the number of patients waiting over 9 months for an ENT appointment, a 30% reduction in those waiting over 9 months for a rheumatology appointment, and a 42% reduction in the number of children waiting over 9 months for a paediatrics appointment. But the Deputy's question is timely because we're currently finalising the outpatients plan, and in light of a raising of this issue, I will specifically and personally look at the issues in relation to University Hospital Galway and make sure that Sales are bringing forward plans to benefit from the additional outpatient funding that we have available in 2019.
Thank you, Minister. Deputy Rabbitte, please.
Thank you, Chair. Minister, thank you very much for your response, and that response is actually very, very welcome. Because I suppose in light of the fact that we have it across so many different departments of outpatients, when you look at neurology, you look at orthopaedics, you look at paediatrics, you look at plastic surgery, respiratory, dermatology, gynecology, right across all departments there is long waiting lists there from 12 months and on. And I suppose it's one of the issues that keeps coming up on a daily basis in my own clinic is in relation to trying to get their very first appointment. People are very, very frustrated, and I think if you could link in and make a priority of the Shelter Group that we could put pressure to ensure that this is not put on the long finger, that it can be delivered as quickly as possible. It would bring a huge comfort to a lot of people in the West, because it is a centre of excellence. It's a level 4 hospital, and it just doesn't cover Galway. It covers up as far as Donegal and Galway and Roscommon and Mayo. So it's vital that the NTP would actually look at the outpatients as quickly as possible.
Thank you, Deputy Rabbitte. Minister, please.
The Deputy said and want to assure her that we will do that. I also just want to take the opportunity to put on the record of the House some of the new outpatient waiting initiatives being tried in University Hospital Galway. There's now a urology pathway pilot, which should see significant progress in relation to wait times there. We've seen in Galway Plastic Surgery Service running an innovative See and Treat clinic. Here we've seen patients attend their outpatient appointment, and if a minor surgical intervention is required, they receive it on the same day. We saw about 220 patients treated for that last year, and the NTPF agreed to fund this initiative from September 2018 onward, with an additional 143 patients accessing the service. We've also seen Galway University Hospital put in place virtual clinics for ENT and vascular services. This is obviously only appropriate for certain conditions, but should see an improvement. We do have an issue with do not attends that the hospital are working on as well. We had 8,494 new patients and 28,689 review patients not turning up for their appointments in Galway University Hospital during 2018. That's not blaming the patients, but it does show there's a need to make sure we maximise that, and they're looking at a text reminder service, overbooking clinics, so that if some people don't turn up, there's another patient waiting to be seen vaccine as well, and sales are going to continue to work on that. So I'll certainly reflect on the Deputy's comments, and we will make sure that sales and Galway obviously benefits from the additional resources that we have in place for outpatients and indeed inpatients for 2019.
Deputy Rabbit.
I would have liked in the commentary, and maybe again you can comment it. It's to do with paediatric diabetics within Galway Hospital. It has been an ongoing issue there, where we have to actually go to Limerick for some of the services or attend to Dublin. It's an outpatients issue there. It's ongoing, and it has been ongoing, and maybe it's to do with hospital appointments or something like that. I don't know, but it's a big issue that comes into my office to do in relation to children. I welcome the fact that ENT is on this and is making progress, because with ears, nose and throat, it can be from a very, very young age to older adults that are actually caught in that. So everything is said here today, Minister, is welcome, but I suppose the action is what we're really looking for in relation to the delivery of it, and it'll only be told when we see the figures that will come to hand. Thank you.
Thank you, Deputy. Minister, your final reply.
Thank Deputy Rabbitte for raising that specific issue in relation to paediatrics and diabetics. I'll certainly have a look at that, and either myself or the HSE will revert to you directly to see if we can make improvements in that regard as well. And thank you very much for highlighting it.